A comprehensive cultural assessment is like a roadmap. It helps us explore the patient's world, understand their motivations, and most importantly, see how their cultural background shapes their health. Good day everyone, I am John Paul Gago Dakanay, and together with Mr. Kelvin Luyabat, Mr. Lawrence Christian Cruz, Mr. Felix Dusono III, Ms. Ashley Nicole Banayat, Ms. Roshan Borja, and Ms. J. Shane Kate Urbano, we formed the first group of Transcultural Nursing for BSN4 Lawrence Kohlberg. To start, let us define what is a comprehensive cultural assessment. So, a comprehensive cultural assessment is a thorough assessment of a person's cultural background, values, beliefs, practices, and experiences, especially in relation to their health and well being. In healthcare, this kind of evaluation enables providers to better understand and honor a patient's cultural identity, which is crucial for offering individualized and culturally sensitive care. The following are the key components of a comprehensive cultural assessment.
First is ethnic and cultural identity. Understanding the patient's self-identified ethnic group, cultural background, and how they perceive their own identity. This helps the healthcare provider recognize the patient's cultural influences on their behavior, values, and perception of health. Second is language and communication. Assessing the patient's primary language, proficiency in the language of care, and preferences for communication, including the need for interpreters. Effective communication is crucial for understanding the patient's needs and ensuring they comprehend medical instruction. Number three is health beliefs and practices. Exploring traditional health beliefs, use of alternative or folk medicine, and specific practices related to health, healing, and illness prevention. These beliefs can influence how patients understand and respond to illness, treatment plans, and healthcare providers.
Religious and spiritual beliefs. Identifying religious or spiritual beliefs that affect the patient's approach to health, treatment preferences, and views on life and death. These beliefs may impact decisions about medical interventions, diet, prayer, and end-of-life care. Family structure and decision making. Understanding the patient's family dynamics, including who holds decision making authority and the roles family members play in the patient's care, family involvement, and the patient's reliance on family can greatly influence healthcare decisions, support system, and communication with healthcare providers. Socioeconomic factors. Exploring the patient's socioeconomic status, including education, employment, income, and access to resources like transportation and housing. Socioeconomic factors affect the access to healthcare, adherence to treatment plans, and overall health outcomes.
Food and dietary preferences. Identifying any cultural or religious dietary restrictions, preferences, or fasting practices that may impact nutrition and treatment. Diet plays a crucial critical role in healthcare management, and accommodating cultural food practices can improve compliance with treatment plans. Next is customs surrounding illness, dying, and death. Understanding cultural practices related to illness, the patient's view on suffering, death rituals, and how the patient and their family cope with end of life care. These customs can shape decisions on pain management, hospice care, and the manner in which death is approached and handled. Next is gender and age roles. Recognizing the cultural norms around gender roles, especially regarding care responsibilities and medical decision making, and the role of age in respect and caregiving. Gender and age can influence who makes healthcare decisions, who provides care, and who is consulted for advice in family dynamics.
10. Social support networks. Understanding the patient's social connections, including friends, community groups, and religious organizations, which may influence coping mechanisms and health decisions. Social support can significantly impact mental health, recovery, and adherence to medical recommendations.
As stated, a comprehensive cultural assessment is crucial because it improves communication, fosters trust, and ensures culturally competent care. But the question is Is it culturally competent for a healthcare provider to provide herbal medicines? What are the reasons why there is an increasing interest in the medical field to give herbal medicines? And how can this affect the healthcare system and to start, there are five main reasons.
First is a rising patient demand for alternative therapies. Many patients, particularly from diverse cultures, use herbal remedies as part of traditional healing. The growing trend toward natural therapies has increased demand for herbal medicine. Healthcare providers recognize the importance of understanding these practices to offer holistic care, respect patient preferences, and prevent conflicts with conventional treatments. Second is the increased focus on integrative medicine. The rise of integrative medicine, combining traditional and alternative therapies like herbal medicine, shows patients' demand for comprehensive care. Healthcare providers who understand herbal medicine can safely include these therapies in treatment plans, guide patients on their use alongside conventional treatments, and prevent risks like drug-herb interactions.
Concerns about prescription drug side effects. Patients may use herbal remedies instead of prescription medications due to concerns about side effects, cost, or preferences for natural treatments. Healthcare providers, especially nurses, need to be well informed about herbal medicines, discuss their risks, benefits, and limitations. This knowledge helps offer balanced guidance and prevent harmful interactions between prescription drugs and herbal treatments. Cultural relevance and diversity in patient populations. Healthcare systems are increasingly diverse, and acknowledging traditional herbal medicine practices is crucial. Providers who understand these practices can integrate them into care plans, offering culturally competent care. This fosters trust, strengthens relationships, and improves patient adherence.
5. Limited access to conventional healthcare. In communities with limited healthcare access, herbal medicines are often more affordable and accessible than conventional treatments. Healthcare providers need to understand these remedies to address financial and accessibility challenges and guide patients in their safe use. This helps ensure that patients receive appropriate and effective care within their means.
To end this discussion, we should always remember cultural competence in nursing involves providing care that respects and incorporates a patient's cultural beliefs and practices. Understanding herbal medicines enables nurses to provide culturally competent care by acknowledging and respecting patients' cultural health practices. This knowledge helps nurses integrate herbal remedies into treatment plans safely, prevent harmful drug-to-herb interactions, and fosters trust. By recognizing the cultural significance of herbal medicine, nurses can deliver personalized care that aligns with patients' belief while ensuring their overall. Thank you very much, B, and thank you for listening.